from the everlasting Gobstoppers.
Wow, that's cool.
Alright, so the article that we handed out, if you just want to read over it kind of as a group, that's just kind of skim it, and then we're going to summarize it and mention what we found out about it.
Okay, so our article is from The Atlantic, and it's called Most Prisoners Are Mentally Ill, and this penitentiary is like starting a program for prisoners that are mentally ill, and it's different from other prisoners because they're trying to like have less staff, or they're having like the same amount of staff but for like less patient or like prisoners, and then other prisons like have like 2 psychologists, 1 psychiatrist for like 400 like prisoners at the same time. So like it's called Security Mental Health Step Down Unit, and this is supposed to give them the option like after they're being treated to like step down to another unit that's not like isolated and like strict. The goal is to like have less relapses and cut like costs of like getting help, I guess. And it's supposed to help because of direct contact, because there's more staff for like the right amount of people. There's been like great results, like not as many people are relapsing, and they're having like better outcomes for the people that are like stepping down to the other units. So they're hoping that like with this like trial that it would like move on to like other prisons around them, or like around the world kind of. So that's the summary.
To give you guys a better idea of how prevalent mental disorders are in prisons, we have some statistics for you. More than half of prisoners have some diagnosed mental illness. It is more prevalent in the female inmates. 73% of female inmates have a mental disorder, and 55% of males have a mental disorder. To break it down to federal, state, and local levels, in the federal prison, approximately 45% of prisoners have a mental illness, and 40% show clinical symptoms of a mental illness. And when I say like clinical symptoms, I mean that the prisoners are showing the signs that are listed in the DSM. They just have never been formally diagnosed. In the state prison, there's approximately 55% with a mental illness and 49% with symptoms. And at the local level, there's approximately 64% with a mental illness and 60% show symptoms. As you can see, it increases as you go from federal to state to local, which can kind of emphasize what Professor G talked about the first week, how important it is to get involved at the local level to try and get more treatments, because more people are being put straight into the jail. To break it down into the different mental disorders, depression and bipolar disorder are the most prevalent. Depression is 21% of people, and bipolar disorder is 12%. Then there's schizophrenia, which is 5% of inmates, PTSD, which is 7%, other anxiety disorders is 8%, and personality disorder is 6%. Lastly, which I think is the worst statistics, is not everyone is receiving treatment for their mental disorders. When asked all the inmates who have a mental disorder, 1 in 3 in the state prison said that they had received treatment, and 1 in 6 of people in the local jails said that they received treatment.
Okay, so we've been talking a lot about mental illnesses, but just to go over what it is, again, from the DSM, it's a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental function. So in association with the research that the Urban Institute did, and that was covered in the Atlantic article, it was discovered that in the United States there are approximately 1/4 of the population who have been incarcerated and who have been granted probation have been affected by mental illness. And as Emily said, 12% were diagnosed as having manic depression, mania, or bipolar disorder. So that was kind of our focus, just to kind of see, since it was one of the higher statistics. So just a reminder, bipolar disorder is identified by the fluctuation of a person's mood and energy, making it difficult to function properly. And according to the Brain and Behavior Research Foundation, there are more than 5.7 million adults in America who are suffering from bipolar disorder. That's a lot. So those who have bipolar disorder experience symptoms of mania and depression, which we'll go over. But I found this picture and I thought it was kind of interesting. It was a simple explanation of, what bipolar disorder is. One day you might feel like Tigger, and one day you might feel like Eeyore. So just some of the symptoms of mania. It's increased energy, activity, restlessness, euphoric mood, racing thoughts, fast talking, jumping between ideas, sleeplessness, and also the symptoms of depression include sad, anxious, or empty feeling mood, feelings of hopelessness and pessimism, loss of interest or pleasure in activities once enjoyed, and thoughts of death or suicide. So when it's diagnosed, there's a couple different types of bipolar disorder. So the bipolar 1 is manic or mixed episodes occurring during a period of 7 days. Bipolar 2 is a pattern of depressive episodes shifting back and forth with hypomanic episodes. So it's a little less severe. And bipolar disorder, not otherwise specified as a person, may have symptoms characteristic of bipolar disorder, but they don't fall under the category of bipolar 1 or 2. And then the cyclothymic disorder, the mild form of bipolar disorder. Okay, and I also found a study, or an article that was talking about the people who have bipolar disorder are at an increased risk for criminal arrest compared to those in the population. And it was stated that combining the symptoms associated with mania with substance abuse seems to be the cause for this increased risk. And so they said that having mental health professionals screen and refer patients and start stepping up could help with this problem. And they also mentioned that psychiatric advance directives, new developments in civil commitment law, and mental health courts are some measures that can be implemented to prevent those with bipolar disorder from being institutionalized.
All right, so this is just like in the article, the Atlantic article, they reference a study done by the Urban Institute, and this is just some information that they took from that. From 1998 to 2001, state budgets grew 8%, and from that, the healthcare costs grew 10%. This one is just about how, the varying states, what they spend on their mental health budgets. And for mentally ill prisoners, there's been a pattern in prisons where assaults, they have higher cases of it. Not only that, but other mentally ill prisoners can be vulnerable to assault as well. It just depends. There's a wide range. So the statistics, in state prisons, 24% were charged with assault were mentally ill, compared to only 14% without a mental illness. Federal prisons is 15 versus 7%. The costs associated with like assault and mentally ill prisoners, it's like cost of discipline, treatment for injury, resources to subdue violent prisoners. So it's just extra costs that if they took precautions, that it would be less trouble and cost for the prisons. So societal costs, which is actually a big factor when it comes to prisoners, especially mentally ill prisoners. It's when they get out, they have poor housing and employment opportunities just because of their mental illness, and like that'll register, that'll show up when they apply for things. And then recidivism. Sure. Okay, it's rearrested for similar crimes. So that's, yes, that is a big word, especially when you're dealing with mentally ill in society, because they have higher rates of going back to prison, they go back to prison more often, they stay in prison longer, and it's, statistics show, like, this is a huge factor, and that could be prevented, you know, if there were treatment in prison. This is a huge one. Study concluded that inmates with any psychiatric disorder were 2.4 times more likely to have 4 or more repeat incarcerations. And that's a lot when you think about it, especially because it's 4 or more, and it's with bipolar 3.3 times more is likely. Criminal justice costs, that just comes with everything when, you know, these people are getting arrested, it's all the police courts. Societal costs, that's like victimization is when it's like, it's kind of like PTSD for the victims, like they have a lot of, they can struggle with being the victim of a crime, like especially if it's violent or something related to like, you know, imagine if like someone with a mental illness like came up to you and, you know, it's not a normal situation if they violently attack you, like or steal something, you know, you're dealing with the repercussions of that, and so it takes a lot on society and families and stuff like that. Also, they have reduced like employment, as I said earlier. So I just kind of wanted to finish this up with some discussion, like talking about mentally ill in prisons. So the Urban Institute, they had a really good question in their article where they said, for policymakers, like, does the cost of crime by mentally ill offenders exceed the cost of their treatment? But I'd say the question for like community and society is, do we let the mentally ill fall beneath the scope of proper care because of costs? So it's just having to do with, you know, like all the policymakers, like they have to deal with costs, but we all have to kind of like incorporate these people in our society, and they're a part of it. Yeah, we're going to discuss it in a little bit. We're going to ask some questions. Also, I wanted to point out something that I read that was really interesting to me. This sentence like popped out to me. It said that mentally they're called mental health courts. They are trying to transition the mentally ill back into the community. And I think that's such a distinction between prisons and keeping them away from us compared to trying to help them and like get them back into community. So we're just, yeah, that's just a few. So we're gonna have some discussion. Does anyone have any thoughts or questions? Oh yeah, that was my favorite one. Are you guys in favor of building prisons? Are you building mental health courts? Because there's mental health courts which are specifically related, they would send, but there's also like programs that can be before like the law system. So it's also important to like think about prevention, not just mental health courts or prisons with that. Do you have any questions for them? I mean, do you have any thoughts? Yeah.
I'm kind of curious on how many prisoners develop mental illness while they're in there compared to like prior to going. I don't know if you read anything about that or if anything popped up.
That wasn't in the article, like in the research that we saw. That'll be really interesting to see. I feel like there would be more things. There would definitely be higher rates because of the stressors. I mean, obviously. Also, I feel like it'd be a different kind of things. Like, because you have like crimes associated with mental illness. Those are the people that are going to be going into it. But maybe like someone that hasn't been diagnosed or like that has just like small symptoms, but they're not actually like full blown, going to prison and the way that they're treated there could like I definitely think that's a huge factor. I'd be interested in seeing those numbers because I think that would really inspire people to wake up and be like, but, yeah.
It seems like you're getting at if they should be put in like mental facilities or prisons. Correct me if I'm wrong.
Yeah, no, exactly. There was something that I was reading about. There was like a case example where this man, who had schizophrenia and depression, he broke into somewhere to stay the night, and that's trespassing, vandalism, everything. And when he went to the courts, instead of giving him that 2-year or 3-year jail sentence, they actually had like a court mandated, like, that was where I got the transition back into society. Like, they had him go to counselors, they gave him probation, they monitored him, they assisted him in finding employment opportunities and housing. And after that few-year period, they'll either be transitioned back into society and all their charges will be dropped, once they're kind of made better, or they'll go back to prison and they'll have to deal with the consequences if they've tried treatment and won't cooperate or it just didn't work out.
Another article that I read too, I think it was for the midterm, it was in USA Today that they were talking about a lot of the people who do go to prison are just because of minor things that's associated with their mental illnesses as well. So we're just kind of...
Yeah, it's a lot of small things. There's a lot of small non-violent crimes where people are going to prison for years for. And I think it shows just mental illness, sometimes it can make you do things, and the consequences from that people are dealing with for years and not getting help. Like a breaking and entering, you'll go to jail for 2 years, but no one will really realize that that's because of underlying causes, Yeah.
Do you know how much treatment in jail costs? Because I know the baseline cost of keeping a prisoner per day is $50.
Yeah.
That's before treatment. So how much would it cost with a prisoner who had mental illness?
Yeah, exactly.
I think it kind of depends on which state, because that was also in one of the articles that I read. It depends on the state to see where the budget kind of falls.
Yeah, because the statistics earlier, it said that was from the early 2000s, but it was a wide range. It said states use between 5 and 43% of their health budgets on mental illness. So when you think about it, 5% compared to 43, that's huge. Especially, but you're taking down all those rising costs, and you're only got 10% towards medical issues, and then less than half of that's going to mental. So I definitely think that it is really expensive. I'm not sure the exact, I didn't read anything about that. I think it is extremely expensive to keep people with mental illness in prisons, especially when it's just a factor and it's not specifically catered to them. And all the costs coming from that, it's not just treatment, but it's everything in their life that's different that has to be made up for in the prison. It's not just regular, considered normal costs.
Here's all our sources, because I know you all were dying to know about that. And then to part, a little joke. So that's it.
Do you have any questions for us or want to talk about anything?
I wanted you guys to go back to, and before we do that, by the way, just if we could give a round of applause. So, as I suspected, you all did in fact set the bar quite high. And so for everybody else to know that this is an exemplary job. The presentation itself was right at 19 minutes right now, but the organization, the citation of sources, the understanding that you clearly have based on the work that you did is again exemplary in terms of the work that you've put into this. So if everybody will take note of that. I would say that you have 100, and you certainly do for the presentation, but I want to say you will, but I want to say a 99 to give every other group an opportunity to just so they can have an opportunity to do a little bit better, because you can't do very much better than what you guys did. But so you're between a 99 and 100 for this presentation today. what I was curious to go back to, and we're at about 20 minutes, so we have plenty of time. We're at 10:30. I wanted you to go back to those questions that you had. Keep going back, right there. And I think those are questions that you all were wondering about. Michael, you asked, and Zach, I think you alluded to. And I was particularly interested, Shanna, you said that you came up with that second question.
Yeah.
Could you say more about that and kind of what prompted that for your group and/or for you to really have that as a what I see as a very compelling question?
Yeah, I see it as really compelling too. Like that, it's a lot of my personal belief coming throughout this, I think. But when I was reading up, I saw a lot of statistics. I saw a lot of research on mentally ill, and a lot of questions that had to do with cost and dealing with these people like they were kind of it's like numbers on a page. And to me, there's a lot of important questions for cost and what it would cost to us to treat the mentally ill, what it would cost for the government, prisons, everything like that. But for my second question, I started thinking about how there's the scope of care in our health system, and a lot of us when you have something wrong with you, you go to the doctor and you get treatment for that, and you have all these options. But someone with a mental illness, maybe because of what they did, because of their actions, their decisions that may or may not have been heavily influenced by their mental illness, they always don't have the same options as us and all those freedoms. So when you put them in a prison, you don't give them access to treatment because of cost, whereas we have so many options for cost, like insurance or raising it or finding help in that way. Just to me, it's a moral question, and it's not just numbers on a page. It's your community, it's the people around you. It's would you rather have your neighbor with mental illness in prison away from you, or rehabilitated and go that extra mile for the people around you, just to make sure we're all sound of mind and happy and can have all the same opportunities and quality of life. So that's why to me that question is so important to just think about. Even if you don't do something with it, that'll be in your mind. You can talk to other people about it, because I think that's extremely important to ask, because it's not just cost. Any thoughts or questions? Conflicting arguments? How about you guys?
We were saying yesterday, we were talking about, we just brought it up that the different people who have been involved in I just brought up the Virginia Tech massacre that occurred, I guess it was 13 years ago now or so. No, maybe, I don't remember. But anyways, whenever that occurred, just the people who did had the mass shooting, the gunman, they said that he had a mental disability, and so with that, if he would have gotten the proper care, how would that have affected everybody? Because everybody lost people, and also how his family was affected by that, because he's gone, so his family is dealing now with the repercussions and people questioning why, so there's just different costs associated. You pay for it in one way or the other.
I wonder if you can relate, all of you as JMU students, each and every one of you has access to absolutely free. You pay nothing in terms of when you go, if you go, mental health care here at the university. You have it used to be called the Counseling and Student Development Center. I think it's a little bit different name now. But now, again, you pay for it in your fees, but that's the same kind of idea as a lot of things. You pay for it, we all pay for it. I don't, because I'm not a student, but all students pay for it. And some students, many students, make use of it if they feel like they need to. And it's completely free if you're a student. I wonder if there's an analogy there in terms of why do we do that at JMU, which is a wonderful thing, and why don't we do it out there in the world? It's just a question. Joey, and you guys are in charge, of course, but Joey seems to have a response, so go ahead.
In response to what you just said,
Yeah,
so we pay money to the school to have those resources available to
That's
us.
right.
Would you like recommend maybe like increasing like our taxes to like support some type of like that? Like I was trying to like think of how we could incorporate that to this.
it's an intriguing question, and though we are on the second floor of Miller, which is political science and not psychology, it's an intriguing question, Joey. And you know, we all do have to make our own political choices and decisions. And again, I think it's an interesting analogy and a very powerful question that you ask. Very powerful question that you ask. You know, what are we willing to do? How are we willing to do this? Given Shanna's, I think Shanna's very powerful argument about this is a moral question in many ways. And so, Joey, what you're saying is, well, wait a minute, maybe there's a moral response. Not quite sure what that would be, but certainly that may be something at least to consider. So again, you know, lots of directions to head and lots of compelling questions that you all are raising.
One interesting thing that they said too in like one of the articles was that I think it was $444 billion go to like just treating people who have mental illnesses. I think kind of like associated the society cost of people who have mental illnesses, whether they go to institutions or you know whatever. So if those costs were just almost like redirected to actually care about those people and take like the necessary measures, you know, that would be helpful. Because I think one person even said that we're treating the problem after it's already like happened. We need to start treating it at the root, so you know, to help prevent.
And does that not take us back to our ACEs, adverse childhood experiences, and that notion of, gosh, if we go back to the root of some of these things and what we know,
Yeah.
so we've come full circle.
Yeah, I think it's all about prevention and putting money at the beginning, and then the like all the consequences from that. The web will kind of like get a little smaller, just from that prevention versus treatment, which I think is really important. Because if someone, you know, just for example, if someone commits like a small petty crime and they go to court once and they're like, oh, like you might have a mental illness, but this is such like a small crime. Oh, we'll just give you a few months like probation or like a few months in jail. But then that can just like escalate. So it's all about like stopping it and like getting the prevention from the beginning.
And there are people that do things that don't have a mental illness, and they're you know, criminals.
Yeah.
and so we have a system. It does seem that we have to get better at saying who are the people that are really the bad guys, you know, the criminals, and who are the people that are really struggling with a mental illness, and actually being in a prison, being in a jail, exacerbates that, makes it 1,000 times worse, and suddenly now they're on a downward spiral that they can't get out of. And as you all said, we all continue to fund all of that in one way or another. You said pay now or pay later, and that tends to be the case that we find in particularly community-based services. Yeah. And I'm talking now with kids. It's a very similar kind of thing, but of course you all are talking about adults. But the issues are very, very similar. Okay. Other questions for the everlasting Gobstoppers? Let's give them another hand.